Good morning, ladies. It's Dr. Carol Lourie, and I'm here with a dear friend and colleague, Dr. Spencer Zimmerman. Dr. Zimmerman is a chiropractor and a nurse practitioner, and he is here to share with us his expertise about a novel way to address and recover from trauma using the amazing ketamine therapy, which is a topic we have not discussed before. So thank you so much for being here, Dr. Zimmerman.
Thank you for having me. I'm excited to be here and to share
So,
with your audience.
thank you. So give us a little bit of background about how you became a chiropractor and then a nurse practitioner, and you developed this area of expertise. It's very fascinating.
Yeah, so I started off with going into chiropractic school because, like many, dealing with some health issues. And I was, as someone in my low 20s, when you're that age, you are the catch-up patient for the medical doctor. I was the 3-minute visit where the doctor would rarely make eye contact with me and then would just like, here you go, and move on.
3-minute visit. Just take a second, just everybody. The 3-minute visit. It's just, you can't do anything in the 3 or the 5 or the 15-minute visit, right?
Correct. And I was like, look, I'm not even being listened to. And I would go to chiropractors and, they were talking about this whole body approach. Now, I can't say every single one I went to took a whole body approach, but there was at least that mindset. And it seemed, even if they couldn't fully help me, they were wanting to dig deeper. They were wanting to spend more time to try to figure out what was going on. I was like, okay, there's a good mindset here. And then when I was in chiropractic school, I found a group that did what's called functional neurology. And it's really about understanding how the brain is functioning and to leverage brain functionality to improve conditions such as traumatic brain injuries, concussions, dizziness, vertigo, strokes. And we worked with a lot of patients from all over the world, but we also worked with a lot of military veterans, special forces specifically, lots of Navy SEALs. And in that group, and in a lot of military veterans, because we got a lot of Afghanistan and Iraq veterans coming back, amputees, PTSD, and everything else.
I just have to say for a second that those people who have donated and their service to our freedom, you can only imagine the level of trauma they have, even if, quote unquote, nothing horrible happened. The definition of horrible, that bar gets lowered when you're in that war zone. So they really do need a special level of reintegration and trauma recovery, 100%.
And so as we were helping them, they're coming in and the VA, they do the best they can, but ultimately people were coming in on 4 or 5 different antidepressants. And we had multiple patients who had serotonin syndrome.
Oh, yeah.
And
you wanted to tell what serotonin syndrome is, because most people don't know what that means.
So serotonin syndrome is what occurs when you're put on too many different medications that impact serotonin. So what happens is, right, you've got like Zoloft or Prozac, but then they can do some SNRIs like Cymbalta, but then you also have trazodone for sleep. So now you've got 3 different ones, but then you also have serotonin-based medications for migraines and headaches as well. And your body can only tolerate so many of those till you start getting side effects, where a lot of people, right, will come in, they'll have tremors, and they're like, look, I'm shaking and I just want that to end. Some people can get faster heart rates and they just don't feel okay. And as a chiropractor, I wasn't allowed to do anything about that. Like, you can't discuss medications. It's outside of your scope. And on top of that, with brain injuries, you can also get impacts in your ability to make hormones. So a lot of these guys were coming in, their testosterone levels were near nothing. And
stress too. Yeah.
And it was like, okay, can you go back to your doctor that I know you despise and say, look, I'm on too many antidepressants. It's making me tremor. Plus my testosterone is also non-existent. I need help here too. And my personality is, I couldn't do that because a lot of them they're like, I don't want to go back. And I was like, either I'm going to do a career where I can provide part of the service I really want, or I need to go back to school, expand my scope and my license to be able to provide a complete and a holistic approach to them versus just focusing on one aspect of their health. And so that's what led me to go back and get my nurse practitioner degree.
That's wonderful. Wonderful story. Thank you for sharing. So how, when you got that wonderful degree and that license, which expanded your scope, did your clinical practice change?
The clinical practice changed because it went from saying, I have to deal with these side effects of these medications and hope and pray that they can find a provider who's going to work with them and really be a part of their team, to say, look, if you don't have someone that'll support you, that's why I went back and did those years of training. I can support you. So I started attracting more people who wanted help getting off medications. And then it ultimately evolved into, using therapies like ketamine and things like that, because there was dealing with the stress response and the past trauma in a way that we just weren't able to get accomplished with doing like visualization-based therapies, having people do talk therapy, cognitive behavioral therapy, or even EMDR. So it's about what is sabotaging the ability to keep the results. Because if people have a lot of trauma, all it takes is a flare up and you can be like, oh, I was doing so good with my recovery. And all of a sudden I went in a tailspin, whether it's from autoimmune, chronic infections, cancer, or anything else. And so it's about taking care of that last really big blind spot that I knew I had.
That's very beautiful. So how do you utilize ketamine therapy?
So we first try to make sure that someone is a really good fit for ketamine. So the number one rule is you have to trust yourself enough to let go. Because if not, when you start feeling ketamine, or you have psychedelics like psilocybin becoming rapidly, popular, if you start going into more of a psychedelic response and you're uncomfortable enough to let go, you'll fight it and you create side effects. So you've got to trust yourself enough to let go, which is very counterintuitive of what many of us have been taught growing up and as a culture. It's like, oh, don't let go, don't do anything that can make you lose control, which is good for some things, but in other ways, the more you try to maintain control, you really shrink your potential, and you ultimately, it creates its own form of handcuffs. And so I have to make sure people are willing to let go and they're at that stage.
I
And
would
the other,
imagine they need to trust you also, that's a very important part of the letting go, that they feel safe with your ability and the process that you're doing.
correct, there's definitely trust in me, but overall, it's more of a trust in themselves that they are going to be okay. Because in the camp of trauma, I break it down into two different types. You've got the conscious trauma. This is the trauma that you're aware of, that you're like, look, I can tell you, here's what happened. I was a kid, or it was in my relationship, or it's just trauma from dealing with a chronic illness. That in itself can become traumatic to your brain because your brain doesn't know the difference. But then there's the other side of the trauma. There's the subconscious trauma. This is the trauma your brain is hiding from you in an attempt to keep you okay.
Correct.
And with ketamine, because about 70 to 80% of my patients will go back to past traumas, they've got to be okay knowing that they may go back to some of those, which can scare people. They're like, well, I don't know if I want to go back. And they've got to understand that the state that you were in when that trauma was created, you're not in anymore. So if you created trauma as a 5-year-old or as a 15-year-old, you're no longer a 5 or a 15-year-old. And not all the traumas you have that your brain is labeled as a trauma really even make sense, right? Just like we don't expect, I've got kids, my 5-year-old, my 10-year-old, they're not the most rational human beings all the time. And as a result, traumas that you may have had from when you're 5 or 10 may not seem rational when you go back and experience it, which allows you to process it. But even traumas that are rational, with ketamine or other substances, you're able to view it from a different lens. So it doesn't impact you in the same way. So you can finally move on again without it being baggage that's weighing you down. Because chronic stress is baggage, It messes with our immune system. It gives cancer the ability to thrive. It gives autoimmunity the ability to flare. It gives chronic infections the ability to keep resurfacing. And you name it, chronic stress is one of the most impactful things in our health. But it's the other thing that we don't really talk about it because it's been considered you're alive, so you're going to have stress versus, but do we all respond to stress the same way? And what does it do to how our body's functioning? So it's not something that is always beneficial for us, and it can damage us, but we have to get out of this mindset that everyone goes through it. So I just have to grin and bear because it doesn't work with the brain and with the immune system.
So when you have ketamine is given as an IV, is that correct?
So there's actually a few different ways to administer ketamine.
Great.
If you see a lot of the ketamine clinics that are popping up, most of them are administering it via an IV. Now, I always recommend if you are going to do it through an IV, make sure you find a clinic that's going to spend more time with you. A lot of the things I hear from patients is it's very hit or miss. Some of them will have great experiences and others it's not. Now, a routine thing is they can start feeling it's too strong. And if you only have an IV hooked up to you, it's timed for 40 minutes. If it's too strong, you need someone who's controlling that dose. And unfortunately, in a lot of these clinics, that's not happening.
Oh.
Which can create a bad experience. So if I'm going to do IV, I'm going to sit with you the entire time, because if it's too much, I've got to pull that back. So that's one way, and probably the most popular way in IV clinics. You also have ketamine through injectable forms, sub-Q or IM, which also can do really well. You have nasal ketamine becoming more popular, specifically in psychiatric practices. And you even have sublingual or troche-based ketamine. So those that do hormones, you've got topical hormones, but you also have troches, which is basically, it's put together kind of a wax formulation where it dissolves and you absorb most of it sublingually. That's another way to administer ketamine. So there's actually a variety of different ways. And I picked the way based upon the intended outcome of what we want from that therapy and the depth of the experience we want you to have.
So do people just do this once, or do they come in for a series, and are they working with their therapist in conjunction with you? How are they supported as their unconscious is revealing more upsetting or traumatic experiences? Because I would imagine that that's a very important aspect of what you do.
So when you do ketamine therapy, the initial is a series of 6 sessions, and that's pretty universal no matter wherever you go. Now, the caveat is if you're on multiple psych medications, I really put that limit at 3. Once you hit 3 or above, 6 sessions is no longer sufficient. People usually need more. There's also been research done where they look at benzodiazepines, which is like Xanax, Klonopin, Valium, that many people are on with anxiety. If people take those medications within 24 hours of the ketamine therapy, it limits their experience to feel joy as a byproduct of ketamine, not only during the session, but afterwards. And that inability to feel joy is called anhedonia. And so it can take those patients, not 6 sessions, but it can take them 10 or 12 sessions. So it's important to have that in the back of your mind. It doesn't mean the therapy may not work, but it does mean you need to be more patient, because Xanax, right? Like ketamine's trying to rewire the brain. It's also working on chemicals. Xanax and other things that people are taking, those are messing with chemicals as well. So you've kind of got this mismatch of chemicals, and you've got this chemical warfare that's happening. So you do need to understand that. Now, as you process traumas, a lot of people will start with counselors, and my average patient that does ketamine has done counseling for 10 to 20 years. And they will get more out of ketamine in 2 to 3 weeks than they've ever had from counseling. And one of the reasons I believe that is when we counsel so much with our brain. We're trying to say, what is a logical trauma that we should be reviewing and going over with? And as we discussed earlier, not all traumas are logical. And so I'll have people who do ketamine and they're like, hold up, I had no clue, but this is a big hindrance. I'm like, perfect. Now, if you need counseling, use that information to then go and talk with a counselor on, because you often get revealed to you what's truly important. And you need someone, maybe it's a counselor. Sometimes it's not even a counselor. Sometimes it's a good friend or it's a coach who can help guide you through it, because people will be like, okay, here's what I know I need to add more into my life. And here's what I know I need to remove from my life from what I've learned. And you just need someone who can help you implement what you've learned, because it's usually a very revealing experience for people. And it's really about taking that and creating an action plan.
So it sounds like ketamine is appropriate outside of the wonderful people who have valiantly served in the armed forces. My community is women with breast cancer and women who have pretty severe chronic illness, and they're motivated and interested in an empowered approach using natural and integrative therapies, in addition to taking the best of what medical oncology is offering. So it sounds like ketamine is something that they can apply as part of their healing process if they're feeling very stuck and they can't, as you described at the beginning, seem to get past one main event to go a little deeper to recover their emotional wellness. Is that an accurate assessment of what we're talking about here?
Yeah, and it's beyond the main event, because that's where we go into the subconscious. I have people routinely who are like, look, I'm depressed. I had a good childhood. My parents weren't alcoholics. I wasn't abused. And then they do ketamine and they're like, man, I had so much more trauma than what I thought. It's just people that aren't able to get across the barrier. So you deal with chronic illnesses, you deal with cancer. So let's say chronic illness and you're trying to get them better, right? You're looking at all the obvious places. You're doing specialty labs, looking at chronic infections, you're doing environmental toxins, and you're working through everything. You're like, why can't we break through? And that's why I found the ketamine side and really going after the subconscious and the mind as a pivotal thing, because for so many of those patients, that is the barrier. And it's when we look at depression research, the depression is a complex neurological issue that ultimately impacts how the brain's functioning. And we look at the immune system within the brain. Now, when we look at the immune system in the brain, the second most researched topic is chronic mild stress. So it's misleading to say we only need to be doing bigger events. The chronic mild stress that you may consider perfectly normal because it's so common for you can be a hindrance. And in cancer especially, cancer loves confusion in the body. And chronic stress is a great way to suppress the immune system, which ultimately is like creating fog in the immune system. And so now your immune cells that should be going through and be like, oh, that's bad, let's go and whack it. It's not going to be able
to. This is very illuminating. So if a woman is feeling, how would you recommend that a woman begin to think about, well, maybe I need to find someone who is an expert in ketamine therapy? What are some guidelines that you can share with us?
So one of the things is to start off, and let's start with the obvious things. So the obvious things is, how was your childhood? So there's what's called an ACE score, adverse childhood experiences or events. It's correlated with all sorts of stuff. Now, some of the questions in there was there drugs in your home? Were your parents divorced when you were little? Was there trauma, physical, emotional, sexual? Did you lose a loved one? Did you grow up in extreme poverty? If any of those are checking the boxes, it's probably something you should consider. Now, on the other side is ask yourself, what happens when you get stressed. Okay. If you find you're like, look, I get stressed, I go from 0 to 60 and I should have went from like 0 to 10 or 20. And you've done everything. You've done breath work. You've done mindfulness-based therapies. You've done meditation. You've worked through the gamut and it's not doing the job. You should absolutely consider ketamine. But work through some of the other stuff first and give it a chance, because not everyone needs ketamine. As much as I love it, it's only about 5 to 10% of what I do. But for those that really need it, it is a game changer. So, but be honest. And in most people, ask your spouse and your friends, because a lot of us, we're not honest about our mood. We're like, oh no, I'm this. And it's like, spouse, what do you think? Oh man, irritable, cranky, they're much more short-tempered, especially, in breast cancer. We get a lot of chemotherapy-induced chemo brain, which can also impact the brain, impact the mood, create a lot of inflammation. And ketamine is a very potent anti-inflammatory in the brain. So there's even benefits beyond the trauma with ketamine.
I didn't know that ketamine was anti-inflammatory specifically for the brain. I think that there's a very specific, in addition to normal or upsetting traumatic experiences that women have before the diagnosis of breast cancer, I think the diagnosis and the ensuing treatment of possibly surgery, chemo, radiation, 18 months, that in itself is enough trauma to necessitate a few moments or sessions with ketamine. I mean, the sooner we can get trauma out of our bodies, the better. That's my attitude. And I'm very appreciative of your expertise, Dr. Zimmerman, and coming in here and sharing this with us, because I haven't had somebody talk about ketamine before. And I think it's a very interesting and important tool to add to your recovery toolbox. Now, would you share with the audience, please? I know you shared with me, but what is your website for women to get in touch with you?
Yeah, my website is idahobrainandbody.com.
idahobrainandbody.com. That's a beautiful website. And if somebody doesn't live obviously locally and you need to find someone, I think, local to do ketamine, is there a referral network that you trust so women can find some people who are expert and not just go onto Google and take their chances?
Yeah, I'm not aware of any referral network on it. The biggest thing is you've got to interview them, because most of the people that are doing ketamine, they are doing IVs, especially in the clinics. And you've got to say, normally they've created a good environment in the clinic, but it's more of reviewing what we've talked about is, are you prone to anxiety and worry? Because if you are, ketamine often isn't the best place to start out. There's other things that should be considered. Whereas if that's not a worry, still talk to them like, look, is someone really monitoring me where they can change the rate at which this is being infused into my body? Because you have to trust yourself enough to let go. And they need to understand that, because when it's done right and you make sure you've got the right person, I'm seeing like a 90% success rate. Now,
what does success mean? What does that look like?
Success means significant improvement in their mood and their flares when they do get stressed. And I didn't mention these two caveats earlier, which I do need to mention. The number one is, who are the 5 people that get your most time and energy? You have to rate them, and they have to be positive people. If they're not, do not expect your ketamine results to last. Okay. Do not waste the money on ketamine. It's not going to work unless you need it as a way to get the courage to change the relationships. But once again, if you do not change the relationships, the results will not last. So next, what are the 3 things that you enjoy to do the most, and how often are you doing this? Because if we're trying to change the circuitry in your brain, everything you do is a signal to your brain, from the food you eat to how you sleep to your relationships and everything else. and the brain will always revert to where it's efficient. And so we have to make sure the brain is getting signals and votes for positivity and to function in the best way. So those are the two things that really matter more than anything else in my experience with ketamine. There are plenty others I could list, but you've got to have that in place to get the best results.
I think that's very, very important. And it is a decision that is cost money. And so you want to also make sure that you have the finances and do the investigative work and make sure it's right for you in this moment. And really be honest with yourself. If this, and I think a lot of these clinics will offer an introductory short meeting to see if you're even a candidate for this. So find someone who in a clinic who has been in around for at least 5 or 10 years. And I think what Dr. Zimmerman said, are you just putting this in and leaving me? Or is somebody going to be there monitoring me? And can I bring a friend to sit with me and arrange, if you're doing therapy or counseling, to have a session shortly afterwards to discuss what has been uncovered for you? And this is something that can become part of your healing protocol and strategy to really recover your health and restore your life. Thank you so much, Dr. Zimmerman. And ladies, this is Dr. Carol Lourie, and I'm signing off for now, and there'll be more later. Have a beautiful day. Take care, everyone. Thank you again, Dr. Zimmerman.
Thanks for having me.